My name is Ruth, and this is Blue. We sometimes call him Blue Martini. He is now 13 years old. He just turned 13. We got him when he was 6 years old. And he is a Blue Merle Collie. He's been pretty healthy, for a purebred, and we've never had a purebred dog before. But I guess maybe age 10 or so, maybe 9.5. We started to notice him struggling a little bit with his hind legs.
Okay.
And, we brought him, obviously he goes for shots and stuff, but at the time, Dr. Jean Arnold at Parker Center suggested acupuncture. We had done that with one of our previous dogs a little bit later in life, but thought it would be a good idea to get him started early.
Wonderful.
He responded unbelievably well to it. He loved it. And did really good. Would go down to the dog park and run and do all the things that doggies should do. With the acupuncture, he was like a brand new dog. And so for that lasted about a good year and a half or so. He just turned 13, so now it's just a matter of managing all of the pain, if you will, and managing it. Where, I don't expect those similar results, but at least I know he's not suffering as much as he may have been previously. When
he first started struggling with his hind legs, did you instantly know it was arthritis? Did you do any tests, or how did you know?
We just kind of guessed just by having a bigger dog like that previously, and just knowing that, the little bit in the back, he would start to sway a little bit, it would start to kind of curve.
Mm-hmm.
And so when we brought him in, she did what they do for acupuncture tests, where they kind of test the whole body, if you will, to get an idea of what's going on inside. And she determined that it's probably arthritis, a little bit dysplasia because he's a larger dog.
Right.
And he has a lot of it in his upper thigh and knees too.
Okay.
And I can sympathize with that because I have it too. Okay. So I kind of, when I struggle going up the stairs, I know exactly how he's doing. She's wonderful.
Okay.
She loves Blue. She does something a little different though. She not only does the dry needles, but she does the thing where it puts the electrodes, so it stimulates them. It's interesting to watch that process because you know exactly when it like kind of hits them a little bit. It's just kind of stimulating the nerve or wherever the needles hit.
Okay.
So she doesn't do the B12 shots. She does this approach.
Okay.
Now there's another vet at that practice that does the B12 shots. So there's just sort of like a different view on the approach to the acupuncture even. But I know that it's relaxing him because he sleeps.
Okay.
Not that he usually has trouble with that, but he really does relax himself where he can lay out better rather than his legs getting splayed.
Oh, good.
So we know it helps him. It's just, we get back, and he is 91 years old if you do the math, right? So, he still eats. He wants to be with us. He's not exhibiting any of those other things that you usually know when the pet's kind of trying to tell you it's maybe time.
Right.
God forbid. But nonetheless, he's still up and around. He plays with his brother.
Okay.
Not as much as he used to.
Right.
But he tries really hard.
Right.
And he just wants to, he's in your face. He barks at the blender like he normally does when you make a shake or something. He's tripping over you in the kitchen when he wants his food. He's got his personality still. He kind of scales himself back.
Okay.
Because when I'm walking, I've got Jack in the front because he's pulling, and Blue back here because I'm dragging him.
Okay.
And he likes to stop and sniff and smell the flowers, if you will, because he's just slow. I haven't. You just do a little push on the bum there.